Good morning, everybody, and thank you all for joining us for the May board meeting here. I would like to call, my name is Kristen Simpson. I am the Vice Chair of the Board of Health and Hospitals, and I would like to call this meeting to order. And alongside that, currently we do not have quorum, and so I will put the approval of last month's meeting minutes to next month's agenda. Unless at some point we end up having quorum, I'll continue to check throughout the session. And if we do, then we can vote on those minutes. And if not, then we'll go ahead and just put them on to June's agenda. Okay. All right. So that puts us on the agenda at the public health funding advocacy update. And so really just want to kind of talk about the things that's happened since the last time we met and now, which actually has been a lot. So what we did right after last board meeting, there were some opportunities for us to advocate with public comment to the Board of Aldermen and the Board of Estimate and Apportionment. And we wrote a collective letter as a board to submit to advocate for public health funding with a focus on some of those existing successes under Dr. Mahdi's leadership, like the city's Justice Center and the health support that's happened there, important food security programming, maternal child health programming. And so we wrote a letter just urging, thinking about the use of vacancy positions that aren't filled, if that needed to kind of be an opportunity to transition some funding to support the programming that's happening right now. And so we did that letter, which was read at the public hearing virtually, I want to say at the end of April. And with that, the City Hall reached out and shared some additional opportunities for advocacy support. And so I was available. It was like a Friday afternoon or evening that they had sent this, and the public comment opportunity was on a Monday. I think I was able to send it out to everyone. I was available to be present, and so I went in person at City Hall to do public comment to, again, advocate on behalf of the board and other city programming to support funding for public health. And so if you missed that, those are available online, but that gives us two opportunities within, a very short time frame with the board was present to show our advocacy. And I really think I'm extremely proud of us. I know we've talked about advocating for a long time and what that looked like, and we were able to do a letter and public comment, which is great. And just showing our support now more than ever, not just to public health funding, but to the department. Thank you all from the department and all of the work that you're doing, especially within the season of transition. Our goal here is to make sure that we're doing our part as your advocate partners, your partners in community, to support your work so that the work continues to be successful and has some backing. So those were the two advocacy updates that I had. And I don't know if anybody had any comments around it or what it felt like. I'm not trying to put anybody on the spot, but I also feel like I've been talking for a couple minutes, and so a little break is always good. So I didn't know if any other board members or department members had anything to add to that.
This is Melissa. I wanted to say thank you for your leadership, because I think I will speak for myself and those of us who also kind of signed on. We are in agreement and we are in support to advocate for public health for the city of St. Louis as the board supports the department, but greatly appreciate the leadership and time for putting the letter together so that we could quickly review and act, because there was not much time given to advocate. And so thank you to the leadership of this board for being so quick on their feet and getting that together so we could act as a unit to advocate for public health in the city. Thank you.
Thank you so much, Dr. Tapey.
Dr. Tapey, you beat me to the punch, but I also want to just thank the board on behalf of the leadership for the department on all of the support of the board, particularly during this trying time of uncertainty with federal funding. it's really important that we all use the voice that we have to try to get positive outcomes for the department and for public health in the St. Louis community.
Thank you so much, Victoria. It's good to see you.
I'll just say thank you, Kristen, for pulling everyone together so quickly and then also representing us so well at the hearing. I was able to join and I thought you did very, very good.
Thank you. Thank you. Thank you. Well, thank you all for all of your collective support. And yeah, listen, we got it done. And I'm just really proud of us for doing that. And so now we know what it takes, what it looks like, and we have some frameworks to use in the future. I imagine future opportunities, I always feel like I find out like within the last 24, 48 hours of something coming up and happening, but at least we have some groundwork that we can go back to as reference points. Speaking of budget updates, Dr. Mahdi led the budget advocacy for the Department of Health yesterday. I think the session was at noon, where she presented to the Board of Aldermen the budget, the fiscal year of 2026 for the Department of Health. So I know that that's a quick turnaround from yesterday to today. So we anticipate that in June, in our June board meeting, we'll have some updates as it relates to kind of like where that funding sits in terms of what she asked for and what they're going to be able to give. Is that correct, Victoria?
That's correct.
Okay, perfect. Okay, so if there are no other questions around that, I can move on to the next item, which actually kind of did. I talked about the fiscal year department budget update, and then I'm going to go ahead and move on to leadership transition, as long as no one has any comments about budget or advocacy. Okay. And actually, right before I move on, I wanted to shout out the team members. I don't see, maybe Chris is one that's on the call who went to the board's tour of the first ever behavioral health clinic in the city. So Chris, were you there?
Yes, I was there. It was nice.
Okay, great. Did you want to talk a little bit about it? Putting you on the spot, but I was not able to make it, but I did see photos.
Yeah, so I forget the lady's name. But she gave us a tour of the behavioral urgent care at SLU, and basically we walked around and it was telling us like the flow of care and about how they do like referrals, like connecting with linkage to care options, and then we got to meet the nurses that was there on staff. They were really nice, and yeah. And Morgan shared a little bit about the research that she's doing, but I don't want to speak on her behalf. But basically, yeah, she was telling us about the resources that was there and offered us to come to the next coalition that they're having in June. So if anybody else want to know about that, we can get that shared out.
Awesome. Yeah, would love information. We can share that with the board of the next coalition. And for those who weren't able to make it, we can maybe curate another time for the board to go get another tour for those who weren't available at this time. Thank you, Chris, for sharing that. And again, you know, as we've been talking about what does advocacy look like, sometimes that's public comment, sometimes that's just showing up to the work that the department is doing and supporting that and getting to learn more about that work and being close to the work. So it's great that we know that that clinic exists, but actually putting our feet on the ground as part of the support system that supports the department, I think is critically important. So thank you for all of you who were able to make it and represent us. We work as a team, so just really appreciate your presence. Okay, so I'll go ahead and move over to leadership transition. I am suspecting and under the impression that all of you on this call knows about Dr. Mahdi's transition. I believe her last day is actually about 5 days from now. May 20th will be her last day as the director of the Department of Health. It is with mixed emotions, right? Lots of proudness from all the work that she's led. Also sad losing her leadership, but excited for new opportunities to meet other leaders in our region that will be able to move the work forward. So it felt very timely and appropriate that during this board meeting, while I don't have a long agenda, I did want to just spend some time talking about some of the accomplishments that Dr. Madi has done under her leadership when she became the director. So I have a list of her accomplishments. I'm going to name most of them. A lot of them she has sent out or has links to the success programs in her letters of transition you will find, but I'll kind of read just a little bit just to honor her space and just tell her that we love her, we appreciate her, and we just are so honored to work beside her and to help support some of the incredible change that's happened in the city. So public health and health services expansion, gonna shout out Dr. Madi, my girl. Congratulations to all the great things. So the Department of Health growth and key successes, approximately 36 increase in staffing since October of 2021. Improving service delivery and public health access was extremely important in the city and to city residents. Successful reaccreditation by the Public Health Accreditation Board, the PHAB, reaffirming excellence in public health standard, which is also critically important. Advocated for 35 state-level public health bills and 28 local board bills, securing funding for health infrastructure. As it relates to the Behavioral Health Bureau, she established in 2023 as a new department, which is also an extension of the clinic that you all visited. And that's the first of its kind in the city, a center to collaborate with SSM Health Services and Places for People to enhance mental health support for the city residents. Health equity initiatives, establish a comprehensive health equity plan for the department and city of St. Louis in partnership with the Community Health Commission of Missouri, which was formerly known as the Regional Health Commission. For mobile health services, added 2 mobile health vehicles to provide services in underserved areas directly to people that helped the city department reach over 13,000 people in 2024 alone, which really enhanced the community outreach efforts and programming. For health partnerships in regional health efforts, the Regional Community Health Improvement Plan, the CHIP, which is a 5-year strategic plan to help kind of with some of those top health disparities that affect our region. So there are 159 organizations working together to improve health outcomes in St. Louis. This was spearheaded and influenced by a comprehensive regional health assessment to address those disparities that impact the region. And the City Justice Center Health Bureau reduced jail deaths to a 3-year low in 2024. So jail deaths were at 6 in 2022, 5 in 2023, and down to 2 in 2024, which is amazing. And I'm hoping that that progress will continue. For health outreach and community engagement, even though this is a couple years ago, we cannot be remiss to not name the impact the city department had when COVID-19 happened, and their response to that to the community was critically important. Provided citywide COVID-19 testing for free during the pandemic when hospitals and clinics were overwhelmed. And as a person that worked in the hospital during the pandemic, I do remember when there weren't enough testing for us to test as staff. And so to have the city department help in terms of being able to get other people tested when our system was overwhelmed is just really necessary and critical to the well-being of all those in the healthcare community. And then last but not least, maternal child health initiatives started the first ever comprehensive, intentionally doula-centric maternal care program for pregnant women. So again, while that's not all of the things Dr. Madi has done, would not want to skip or miss the opportunity to name some of those great achievements for Dr. Madi. If she ever watches this or if she's watching now, we love you, we'll miss you. We are so proud of you and we are honored to be able to work with you in all of the great things you've led in the city, the trailblazing that you've created, and we will be a part of pushing those things forward and making sure that this work doesn't go away. And before I move on to the next agenda item, I wanted to ask if anyone else had any words that they want to say in regards to that.
Thank you, Dr. Madi.
Bow, bow, bow.
Huge thank you to Dr. Madi's leadership and her advocacy.
I would add on a big thank you to Dr. Madi. I've enjoyed just observing her leadership and how she leads, and really learned a lot in the past couple of years just watching her in general, but excited to see what her next steps are.
Yes, we're excited for you, and we might bug you sometimes. I'm just joking. It's just because we miss you. Thank you all. We love you. We can't share our love for you enough. So thank you for all of your leadership, and we are excited to work with whoever comes in next. I do want to honor some things that are in the chat. Brittany says it was such a beautiful summary, that it's been wonderful to witness and experience these achievements, simply inspirational. And then Craig, did you want to come off mute and name an opportunity, or I'm also putting you on the spot? But
Yeah, not an issue. Thank you very much. So I just was hopeful that with 2 days notice, it might be better than last time. I don't know. So I just learned of this yesterday. It is on the city's website. So at Thomas Dunn Learning Center at Marquette Park, 3113 Gasconade, on Saturday from 10 to 12, there's supposed to be a hearing by the Budget and Public Employees Committee to get public input on the budget. So it's an opportunity once again to be front and center and let them know how you feel. I know there's lots of things going on. There is every weekend, but if there's an opportunity, that's it for you and available.
thank you so much, Craig. I think it's important. Yes, anytime. Y'all can always email me if you hear about public hearing opportunities. I do feel like when they come, I have like very little time to get the word out and see, match schedules. So I will send this out to board members as I find the links and all the details. And if you all are available to support, and if you need anything in terms of, talking points, the letter we wrote before is a great place to start. If you need another copy of that, absolutely do that. You can read the whole letter. That works. I think they give you about 3 or 4 minutes either way. So yes, let me know if you all are able to make it. Any of you are able to make it if you look at your calendars, and then I can help support you in that. Thank you so much, Craig. Okay, I am going to transition to move toward the next agenda item. And I don't know if it's the right words to say that I'm excited about, but I am. I'm so happy to have David Courtney here with us today. I think one of the things I was hoping to accomplish in this board meeting was talk about some of the current public health issues and crises that are happening right here in our region and specifically in our city as we think about the measles outbreak and just having an update around that. And it's also a good opportunity to remind people how important public health is and how it really impacts us all. So thank you all for your hard work, and I'm going to turn it over to you, David.
Great, thank you so much. I'm so glad to be here. Let me see if I can share my screen. I have put together a little presentation today just to summarize what has been going on my end at least. All right, can everyone see my screen in presentation mode?
Yes.
All right, thank you, Craig. So again, thank you so much for having me today. My name is David Courtney. I am an epidemiologist here with the City of St. Louis Department of Health. Specifically, I do work in communicable disease, and I have been with the city for about 5 years now. And again, of course, we have all heard about measles recently, so I am here to give an update for the City of St. Louis. So just to give you some overview of what we'll be talking about in these next 10 minutes, we're going to discuss measles, describe the disease, and discuss the current situation nationally and locally. And then we will dive into how there's recently been an exposure in the city of St. Louis. We'll talk about the timeline and the Department of Health response. And then moving forward, we're going to discuss awareness and prevention and the next steps we will take. So again, just to give you all a brief overview, I'm sure you've heard a lot about measles recently. and you've been reading. But just again, measles is a highly contagious acute viral illness, and it is spread via respiratory droplets. It's important to note that it is contagious, very contagious, and it can be up in the air for 2 hours after an infected person has been in a space. The secondary attack rate is quite high. Roughly 9 out of 10 susceptible contacts are likely to be infected if exposed. The incubation period is 7 to 14 days. And those common symptoms that will appear after the incubation period are cough, runny nose, red watery eyes, conjunctivitis, and fever. And then those typically present a few days before a rash. And that is what measles is most commonly known for, is its rash. And unfortunately, beyond those symptoms, if a person gets very sick, complications that can occur are pneumonia, encephalitis, and death. Fortunately, though, it is a vaccine preventable disease, but we will discuss later why we are in such a concerning spot with measles. So again, here's the national situation. The data is recent as 5/9 from the CDC. In the United States, there have been 1,001 confirmed cases in about 31 jurisdictions. And as you can see, that is a very high number, but I've also posted the numbers from 2024 and 2023, and you can see that it is just, it has grown exponentially over the past couple of years. And this is, again, speaking to the fact that in 2000, we thought we had eradicated it. So there are 14 outbreaks currently in 2025. About 93% of the confirmed cases that have been, we've been made aware of this year have been related to those outbreaks. As you can see also on the right-hand side, I've provided a map of the different states in the United States and the number of cases that are there. Obviously, the more dark the state, the blue, the more cases there have been. So you can see Texas, with everything that's been going on there, has had a ton of cases. But also, unfortunately, again, measles does have the potential to hospitalize people, and 13% of confirmed cases have been hospitalized. And there have already been 3 deaths reported, 2 of which are pediatric. So diving a little closer to home, so I misread this, but in 2023, actually, there was a recent case in the St. Louis area. It was associated with international travel, and it was mostly in St. Louis County and St. Charles, but they were able to contain it quickly and there were no associated cases. But in 2025, Missouri has already had 2 confirmed cases, one in Taney County and most recently in New Madrid County, which are both in the southern part of the state, southwest and southeast regions. And then our neighboring state, Missouri, has had 8 confirmed cases, notably in Cook County near Chicago, and the southern Illinois region. And again, we have not had any cases reported here in St. Louis, but recently, as I'm sure you all have heard and read about, there was an exposure in the city of St. Louis. So on April 30th, there was an out-of-town guest visiting the St. Louis Aquarium at Union Station, and they were present between 1 and 4 p.m. And unfortunately, they were later confirmed to have measles. And we will make note that this individual was unvaccinated. But again, the concerning part too is with how contagious measles is, and how it can be contagious 2 hours after the fact of when a person was in a space. Anyone present within the aquarium had a chance of being exposed between 1 to 6 p.m. And there's a good chance they could develop measles if they were not fully vaccinated. So the timeline and response for the city of St. Louis, again, just to reiterate, the individual was there on April 30th. Their rash was said to have begun on May 2nd. And then they, when were tested and they were positive for measles, and Missouri was notified on May 3rd. And then, of course, the evening of May 3rd, around 9 p.m., the Missouri State, the DHSS reached out and notified the city of what had just occurred. You know, we all love getting those emails that say urgent, please call, right before you're about to go to bed. But fortunately, it was a very quick reaction. And I was able to email Dr. Mahdi and the comms team, and that way they were prepared to begin discussions the next morning. So on May 4th, the DOH started to collaborate with Missouri State to meet and formulate a press release about where the individual was within the city. And then that press release was shared that evening for the 10 o'clock news. And then the next day, the team assembled and we produced an information brief for the community. And later that day, we were able to begin discussions with the aquarium. And the aquarium was very helpful and provided contact lists for the employees and visitors that were there during that day. And kind of, just to kind of speak to the response. Sorry, I jumped ahead a little bit. Now I'm trying to go back. All right, well, thank you for that. Sorry about that. But the DOH has responded quite quickly, and the DOH has been working closely with the aquarium and again, the State Department to notify anyone present during the established exposure window. A lot of times student groups will visit and take field trips to the aquarium. And during the time the individual was there, only one group of students was present. And those school officials have been notified. Our Communicable Disease Bureau has reacted quickly, and they received lists of the patrons, the employees, and the student field trip group. The staff and our Communicable Disease Bureau are currently contacting everyone to let them know of the exposure and discussing the next steps. We have been in contact with most of them or reached out to most of them, and we are still working through all of that. The DOH is currently coordinating with other health departments to refer out the out-of-district attendees to their respective jurisdictions to speak to their health departments for follow-up. And then our communication team and director have responded to media requests for updates and information. And they continue to communicate about the symptoms and best practices via social media. And again, kind of some of the things they have been communicating. And since we discussed earlier about the incubation period, symptoms can develop after like 7 to 14 days of exposure. So we're now kind of getting into that time frame of anybody that may have contracted it during that exposure may begin experiencing illnesses within the next few days. Again, what we're looking out for is a high fever, cough and a runny nose, red watery eyes, and that distinctive rash that usually begins on the face and spreads to other parts of the body. And should any individuals begin to experience these symptoms, we recommend that they immediately isolate and contact their care provider. And we want them to stay put as well, just because if they are infected by traveling to the provider, they could expose a lot of other individuals. So you want the provider to be prepared with the correct space and the proper, equipment to protect everybody. And then they can make arrangements for the person to visit them. And then also just to know, the rash may not develop for several days after the exposure. So do not wait for one to appear if you're experiencing any of the other listed symptoms. And of course, we are talking a lot about vaccination. So if people are living in the St. Louis area and they're concerned, we can encourage them all to know their vaccination status. And if they are St. Louis residents, they can contact our medical records team. But again, kind of speaking to vaccinations, it is important that people are aware of their status. But the reason we are just so very concerned is measles is so contagious. And while it can be prevented with the MMR vaccine, which is a 2-dose series, unfortunately, a lot of people are not vaccinated. For a statistic, 96% of confirmed cases in the US have been unvaccinated. The vaccine does work very well. And unfortunately, again, the vaccine is typically administered to children. First dose usually around 1 year, and the next dose around kindergarten age. But as you can see, based on the national statistics, 38% are in the 5 to 19 age group, and then the under 5 age group, which is one of our most vulnerable populations, 30% of cases have been in that age group. And then looking closer at the local statistics, unfortunately, nearly 10% of Missouri kindergartners are not vaccinated. And that number has fallen in the past couple of years, and it's fallen by 4%. And then as you can see too, there's a graph on the right, and it shows Missouri numbers versus Missouri rates versus the city rates for vaccination with MMR for school-age children. But 25% St. Louis parochial school children are not vaccinated. And that number is very low. And if you think too about the herd immunity, and it's said to need to be out 95% to protect against measles, we are not close to that. So the next steps for the DOH, we are continuously working on this situation. The Communicable Disease Bureau will continue to reach out and monitor and educate all of the contacts from the aquarium. The Epidemiology Bureau specifically, we are conducting surveillance for suspect cases via provider communications, lab reports, Essence, which is a syndromic surveillance system. We've set up a query in that. And as soon as we have a suspect case, we report them for investigation and to get further testing. The Department of Health is also working with the city web team, and we plan to create an online resource page to discuss measles and provide the data and, of course, tips and information for preventing further illness. And then the Department of Health Administration is working very quickly on constructing guidance and policy. We're researching jurisdictions that have had other recent outbreaks. And ultimately, too, we are working with the Pandemic Task Force to produce consistent regional messaging for our measles response. All right, so now's the time when I can take some questions. Thank you so much for listening to me. And yeah, also I appreciate your patience as well.
Thank you so much, David, Courtney. Yes, agree with Liz. It was very informative. It was just kind of great to see all of the work. So first, thank you and the team for how swiftly you all responded. I think it's just so important when you hear about viruses coming into the space, especially with the PTSD, I feel like we all have after the pandemic, just having some awareness that, our city, our region has an action plan. And I know that means that you all sometimes have to work after hours, and I'm sorry for that, but we appreciate the notice and awareness so that we know how to protect ourselves and what it looks like. And you're kind of surveying the area to see where our potential threats are. So thank you for that. I did have a question, and I was hoping that I wasn't going to be the first person to talk, but that's just how life goes sometimes. So my question was around the fact that it's transmitted through respiratory droplets, but I didn't know if there was any discussion about ways that immunocompromised people can protect themselves. So I know there are some people that hesitate to talk about the 4-letter word, the mask. And I didn't know if that had any role in being able to support someone that may need extra precaution, not knowing, who they might be around, and specifically talking about the length of time exposure can exist in a space.
Yeah, no, I definitely, when you talk about respiratory illness, a mask can be a good preventative measure, and something that people that are immunocompromised may want to consider. Again, too, I just always encourage people to know their vaccination status as well. The vaccine itself is, very successful at preventing disease. So yeah, if immunocompromised people are still worried, they can take those preventative measures, and we will actually probably put that on a resource page as well, and make sure that people are aware of the different ways they can protect themselves depending on their situation.
Liz.
I have an additional question. So, I do have a 94-year-old, very active grandmother, and I am curious, are there certain age groups at this time where it would be recommended to get an updated vaccination?
That's something too. So unfortunately, I'm not a medical provider, so I can't quite say, but that is a discussion I think that your grandmother should have with their provider. And there are ways to test for immunity as well. I've had the same discussion with my mother, and she's kind of in that range too, where there was that switch to the new vaccine. So we just, again, want people to be aware of their vaccination status, to be in contact with their provider. And then if their provider does have any concerns, hopefully they can do the immunity testing. And if not, and if they do for some reason feel like the numbers are low, then they may be encouraged to get a booster shot. Sure.
Great. Thank you, David. This is Melissa. Yeah, Liz, currently there's no overall CDC guidance for booster MMR, so to speak. David's exactly right. I would discuss with your primary care clinician, and they might do immunity testing if there is concern. But knowing your vaccine status is exactly the most important thing in this situation. And I wanted to thank the Department of Health, David, and Dr. Mahdi's been on the task force calls, advocating again with a very strong voice, for the city and its residents, and how kind of our regional communication comes out as a team. I know they're meeting again this afternoon. And so that representation has been strong. So thank you all for continuing that public health work, because that is for communities. That's also for, the healthcare organizations, right? Such as Affinia and the community health centers as well, so that we can best prepare, right, our teams and our patients as well. If someone does come in, with measles symptoms, how best to prepare our staff again to ensure our staff are vaccinated, because this also has, if there's exposure, this has quite a bit of consequence too for, then staying at home and maybe not working or not going to school for a while, because it is so contagious. And again, the way we minimize those consequences as well are vaccination and knowing your status. So that's so important right now. Thank you, David.
Thank you so much, Dr. Tapey, for lending that medical expertise in this space. I feel like I saw this on the social media outlets from the Department of Health, David, and perhaps you could confirm for me. And I really appreciate the information sharing on your social media platforms. I feel like one of the slides talks about how you can know your status, if I'm remembering correctly. And if not, that was going to be my next question, for those that may be watching now or watching this later. What are the ways that they can learn about their status? I know that they can go to their primary to test for immunity, but are there ways that they can call the department to check records or anything like that?
Yeah, exactly. Yeah, and you are correct. On one of the slides, I did mention that you can contact our medical records department. And if you have been growing up and living in St. Louis, those records should be available. And they should actually, there's also an online resource too that providers have called Show Me Vax, and you can check to see if you've been vaccinated in the past as well. But
Perfect.
again, that number is available on our website, and I can actually look it up now and post it in the chat.
Okay, yeah, great. And then I think Dr. Ludi, thank you, also included the Show Me Vax resource there. So there are ways that people can figure out their status. So it's awesome. Any other questions around this? Okay. Well, thank you again, David. I feel a lot more clear about, what all transpired and brought us to this space. So I just thank you for going down even the history and what we're seeing at the current level in terms of spread and protection and all other things. So thank you for being here and supporting this today.
No, thank you all so much. Very happy to share. And yeah, if you have any questions, feel free to contact the health department.
Okay. So that actually is one of the last items on our agenda today before we officially close out for the meeting. At this time, we still don't have quorum, so we will officially move the meeting minutes from last month to June. And before we close out, I just wanted to ask any department members that are here if there are any updates that you all want to share. I know I'm kind of putting you on the spot and no pressure. If you don't have anything to share, but just wanted to lend this opportunity, particularly because we're in transition. And one of our goals as the board is to really try to make sure that we're in position to support you. And if there's something you want us to know, if you want to say it here, if you want to discuss it with us offline, either works. But I just wanted to lend an opportunity for you all to share any updates or any awareness about anything before we close it.
Efforts
That's
with
directed to
public
me.
health in the city, but we always need to be vigilant about that. And so these funds
Kristen,
will
is that
allow
for
us
me?
to provide some staff development opportunities. They will also allow for some
Kristen?
emergency preparedness with
Is
regard
that for
to
me?
public health accreditation.
I think so, but I am
Okay,
also
sorry,
also-
I'm kind of juggling two calls, but I will
Gotcha.
get with you offline, for
Okay.
sure, to talk, but thank you for that, opening.
Okay, thank you so much, Victoria. Let's see. Okay. Shantae, anything on your end? Y'all all might be in the same other call, so I respect that if you are, and we can talk.
No, I am not. I'm here.
Okay.
No, I don't have anything to add. I just appreciate you all on board and having the opportunity to speak and share and the support that you give. So, no updates.
Okay. Well, yeah, we appreciate you too. You've been doing that work, girlfriend in the streets. We appreciate you so much, and I know the city does as well. So yeah, anything we can do, please don't hesitate to email us. You can email me and I'll make sure we get it out to the board. Victoria, whenever you have opportunity, we can connect. I don't have any other announcements, board members, except for our next meeting is scheduled to be on June 19th. And we will put out an agenda a few days before. Please reach out to me if you have any questions, or reach out to, I think the point of contact right now would be Victoria, if I'm remembering correctly. Yes, so if you have any questions for the department, start with her. You can always CC me, or you can tell me, and then I will communicate with Victoria, myself, and April, who was unable to be here today. Well, that's all I have. I love giving the gift of time back to folks because, life is busy. So I am calling this meeting to a close, to adjourn officially, and I will see you all in the near future.